Our connections make powerful things happen, uniting individuals and communities. We are Rotary. We are people of action. And together, we turn great ideas into reality by accessing our networks, our experience, and the best of ourselves to make a difference. Around the world, Rotary brings leaders together to build new friendships and to solve problems. Like in Austria, where generations work side by side to come up with innovative ways to build sustainable housing and community centers. Everyone learning from each other. In India, volunteers run a mobile blood bank to help provide a steady blood supply for their local community. And in Taiwan, people are working hard to get vulnerable citizens the support and services they need. With over 1 million members, we know what people can do when they come together. In your backyard and around the world, there's power in our connections. Take action with us. Find out more at Rotary.org.
Good evening, ladies and gentlemen. Once again, welcome to the Rotary E-Club of 3310 panel discussion. My name is Chu Ban Singh, and I'm a moderator for this evening. Today's topic is on blindness prevention and how we as Rotarians can get involved. Over the last 30 years, there has been a great reduction in the proportion of people with visual impairment and blindness worldwide. However, there's a problem. There's a growing and aging population, means that there will be challenges of eliminating avoidable blindness in the years to come. In 2015, there was an estimated 253 million people with visual impairment worldwide. Of these, 36 million were blind, and a further 217 million has moderate or severe visual impairments. On a socio-economic front, 89% of visual impaired persons live in low or middle income countries. So that's the issue that we as Rotarians needs to face. World Health Organization has estimated that up to 3/4 of blindness worldwide is avoidable. In children, about 1/2 of the causes can be prevented or treated. So ladies and gentlemen, this evening we have a wonderful group of people who are experts in their field, and I'd like to introduce each one of them respectively. The first person, of course, is past District Governor Sir Sat Ahmad. Sir Sat Ahmad is from the district of 3272 in Pakistan. Sasat is well decorated. He won almost every award there needs to be a won in Rotary. He received the Service Above Self Award, the Regional Service Award for Polio Free World, citation for meritorious service in the Rotary from the Rotary Foundation. Today, Sasat Ahmad is the Rotary Coordinator Zone 1B, Pakistan, Bangladesh, Indonesia. Sasat, of course, is very important to us in the blindness prevention. She is the chair of the Rotary Action Group. This year, he's also the member of the Council on Legislation and he's also the District Grant Subcommittee Chair. Ladies and gentlemen, let us welcome PDG Sasat Ahmad.
Hello, everyone. Thank you for giving me this opportunity to speak with our friends all over the world. And thank you for the kind introduction. I'm the chairman for the Blindness Prevention Rotary Action Group this year. And I look forward to this very interactive and very informative panel discussion. And I'm sure it will be beneficial for everyone who will be watching us. Thank you.
Thank you. The next panelist is, of course, past President Dr. Koresh Maskati. Dr. Koresh is from India and he's from the Rotary district of 3140. He was also the past assistant governor and he's an award-winning consultant eye surgeon and ophthalmologist. Tonight, it's my pleasure to introduce him in such a way that he's involved in everything that's respective to the eye. He's the past president of All India Ophthalmology Society. He's the past president of Corona Society of India. He's the past president of International Small Incision Cataract Society. So, ladies and gentlemen, let us welcome past president Dr. Koresh.
Thank you, Ben Singh. Ben Singh is a good friend, but I'm really excited to be here, not only because the topic is so close to my heart and something that I've been working on since the last 35, 40 years now, but also because it so well symbolizes what we saw in the short film, the internationality of Rotary. Here we have friends from 4 countries, India, Pakistan, Malaysia, Singapore, all together on one platform with one united mission, which is to reduce blindness the world over. There's no other organization I can think of besides Rotary which can give such a wonderful platform for these ideas. Thank you so much for having me here, Ben Singh.
Thank you. The final panelist is, of course, past Assistant Governor Dato Kulasigaram Sabaratan, who is a lawyer by training. Dato Kulasigaram, or in short, Dato Kula, is very well connected in Malaysia to the blindness scene. He is a member of the board of directors of Orbis International, New York, as well as Project Orbis International, Singapore. He's the chairman of Rotary District 3300 Action Group for Blindness. He's a member of the executive board of the World Association of Eye Hospital. He's a founder president of the ASEAN Association of Eye Hospital. He's a member of the Rotary Action Group for Blindness Prevention, Rotary International, past president of National Council of for the Blind in Malaysia, past president, Malaysian Association for the Blind, deputy president and chairman of EXCO, Executive Committee of the Malaysian Association for the Blind, vice chairman of Tun Hussein on National Eye Hospital and chairman of the Executive Committee, vice chairman of the National Institute of Ophthalmologic Science, and of course, past president and past assistant governor from District 3310. So let us welcome Dr. Kulai, past assistant governor, Dr. Dato Kulai.
Thank you very much, C.P. Ben Singh. It was a very long list. Sorry you had to struggle through that. My apologies for being the list so long. Anyway, I'm so happy to be one of the panelists to speak about prevention of blindness, which is close to the hearts of the panelists. I do not want to say more except to say thank you for including me as a panelist. Thanks, Bunch.
Thank you, Dr. Kulai. The first person I'd like to call upon is, of course, past District Governor Sazad Ahmad. He's the chairman of Rotary Action Group for Blindness Prevention. So I'd like to ask him to introduce perhaps the action group and what Rotary hopes to achieve through the action group. PDG.
Thank you, CP Banks and Tube, for giving me this opportunity. And I have made a small presentation, and I'll try to cover the salient points in it. And so in the next slide, I just had put my introduction, so we'll just skip it because you have already very kindly elaborated on that. This is an important slide, and I dedicate this presentation to past Rotary International President Frank Devlin, who unfortunately passed away last year. He was a fatherly figure to everyone known to him. But he had a very special relationship with the Blindness Prevention Rotary Action Group, uh, because he was the patron in chief of our Rotarian Action Group, and he was always there to support us. He supported the Rotarian Action Group financially also. So uh, so that is why I dedicate this presentation to our friend, our hero, our Rotary leader, past Rotary International President Frank Devlin, who passed away unfortunately last year. So next slide is where I'll just briefly mention about the mission of our Rotarian Action Group. And it is basically that we want to bring together in fellowship and service all Rotarians who have interest in the prevention of blindness and who want to promote eye health and vision worldwide. And that is the beauty of Rotary, that it's an international organization. So that is, as Dr. Quresh also mentioned, that this is how we all work together. We are from different countries, but we are working together here for one common cause. We also want to provide a platform and a forum to discuss ideas and develop cooperative programs to further our shared goals. So our RAG also help in sort of a matchmaking in supporting the projects doing blindness prevention related projects. And we also want to promote international understanding and goodwill and peace through our common purpose. And that is where we collaborate on doing different grants together in different parts of the world. Next one, before we became a Rotarian Action Group, so we were basically earlier Fellowship of Eye Care Professionals, and so then we became Rotarian Action Group for Avoidable Blindness, and then we transitioned to the new name of Blindness Prevention Rotary Action Group. And all Rotarians who are interested in preventing blindness and in improving eye health care are invited to become members of this Rotary Action Group. Next slide shows our officers and board members. There are 9 of us. I am currently the chairman. We have our vice chairman, past District Governor Manjeet from India. Then we have representation from the USA, Malaysia, Sri Lanka, and Germany. So basically 6 countries are being represented on our board of 9 members. And next one is the eligibility. Basically, all active Rotarians and their spouses and partners, as well as members of Rotary clubs, they can become members of our Rotarian Action Group. And at the same time, honorary memberships can also be bestowed upon leaders in the profession who may be non-Rotarians, but that can be done at the discretion of the board of directors. Next slide is our membership dues. We have 2 types of dues. One is the annual dues, which are for Rotarians and spouses and partners are $50. And then to give incentive, we also have a 3 years dues, which are $100. So in other words, by paying $100, we become member of 3 years. So basically that we save $50. Similarly, for Rotrax, the annual dues are $25, and for 3 years, the dues are $50. So again, that means by becoming a member for 3 years, they can also save some money. The next one is that I'll just briefly, since the time is short and we also want to give time for the question answers, so I'll just briefly, as a sample, just discuss about some of the projects being done by Rotarians all over the world. And this is Rotary Club of Lahore, the oldest club in our district, C272 Pakistan. They have they have partnered with LRBT Hospital, and they have provided cornea transplants to 435 people so far. And the project started in February 2015. The next one is of a global grant where it was done in India, in New Delhi. Some equipment and renovations were done for Rotary Eye Care Center in New Delhi. And the partners were the clubs in Delhi, in India, as well as clubs in Hawaii, USA. And next one is again a project done in India where 1,000 cataract surgeries were done at Rotary Shroff Eye Care Hospital, Eye Care Center in New Delhi, India. Okay, so now what we do as RAG, as Rotarian Action Group, that what we of course, we try to promote the work of our Rotarian Action Group. And the reason or the way we do it is that we normally have stall or booths at all the Rotary International Conventions. Then we also participate in the important events, conferences taking place in different parts of the world. And so this is an example of a booth where you can see myself there and one of our board members, Mark Harbison, very active member from Hawaii, USA. The booth was at the Rotary International Convention, Bangkok in 2012. The next one, we'll see another booth at Rotary International Convention in New Orleans, 2011. Again, you can see past Rotary International President Frank Devlin is there. And then there is a couple, past District Governor Walt Schloer and Harriet Schloer. So they basically, you can say, the main persons behind this are Rotarian Action Group, and they have been actively participating in all type of activities, and they have been a member of the board also. Harriet is executive secretary, and Walt is a former chairman of our Rotarian Action Group. Next one is where this is just last slide, and I just want to thank you for giving me this opportunity to speak to you, and I look forward to our next question answer section after my worthy colleagues and panelists, they are done with their presentations. Thank you.
The next person who is going to present to us is he's actually requesting you to please donate your eyes. And I thought it's a very interesting topic. So I'd like to get Dr. Quresh Mascati to actually share with us how we can donate our eyes and why do we need to donate our eyes. Dr. Quresh.
Thank you, Ben Singh. And we'll start straight away with sharing my screen on everything you should know about eye donation. Is my screen visible?
Visible, yes. Can you do it? Yellow, yes. Beautiful.
Okay. So this is everything we need to know about eye donation compressed into 7 minutes. The whole eye is not used. It's only the cornea. The cornea is the front part of like the watch that we are wearing. The front part of the watch, the clear glass, that's called the cornea. It's normally clear, but it can become cloudy, as you see in the before picture in the screen. And we change that cornea, not the whole eye. And we put a new cornea from a donated eyeball. And the cornea becomes crystal clear, as you see in the after picture on the screen. And the patient can see well. So is there a need for eye donation? Yes. In Asia itself, over 1 million patients are awaiting corneal transplant surgery. Most of them are children and young adults. The total number of eyeballs collected in the largest country in my group, which is India, is only 50,000. So it's estimated that for every eyeball which is actually utilized by us to restore sight, there are 100 more patients waiting for that same precious gift. So instead of burning or cremating our eyes, we should think in terms of donation because there's a huge need. As I told you, the whole eye is not used for the transplant. Only the thin transparent layer in the front is used. It's called the cornea. So that's the patient with an opaque cornea, and that's how the patient looks after a corneal graft where it's clear. What about rejection? When you take a kidney transplant, liver transplant, it gets rejected. It can get rejected. Human cornea, mercifully, God has created without any blood supply. So the body doesn't know a foreigner has come to stay in the body. So the risk of rejection is very low. Rejection, if it occurs, can be suppressed by just eye drop medication. Chances of success are greater than 80%. You see the picture there, 2 years after surgery, clear. And a patient 20 years after surgery, you can't even make out that he's had a corneal transplant. So what is new in corneal transplant? Something new has occurred now, that previously we used to take the whole cornea, as you can see in the picture on the left, what is called a full thickness transplant. The full thickness was removed and replaced by a full thickness donor. But now, suppose only the top layer is defective, we can change only the top layer. And somebody else, the bottom layer is defective, we can change only the bottom layer. So one donated cornea can be used to restore sight to 2 blind patients. Isn't it amazing? So what about corneas which are for some reason unfit for transplant? If the donor has HIV/AIDS or septicemia or something, you can't use that cornea. So even those corneas are useful for research and training programs. We train our students in how to use the cornea, how to do corneal transplant. So no donation is ever wasted. Does corneal transplant guarantee sight to all blind people? No. As I mentioned earlier, only those in whom the loss of sight is due to the front layer, the cornea getting affected. Like you can see the first 2 pictures, the cornea is affected. In the second picture also you can see central white spot in the cornea. But in the third picture, what you may not realize, not being eye surgeons, is that's the optic nerve which is being seen. We can see the optic nerve which is right at the back of the eye, and that's very yellow and pale that you can see. It should be pink. So the patient is blind because the optic nerve is dead. In those cases, corneal transplant will not help. How will the donation be used? So after the eyes are removed, they are evaluated, processed, and screened by the eye bank. In Mumbai, we have the Rotary Eye Bank and other eye banks, and then it's supplied to the eye surgeon for transplant. So inside the Rotary Eye Bank, there are lots of clean air and clean environment, sterilized areas in which the cornea process is removed from the rest of the eyeball and is stored in a special tissue called MK medium. And then it's put in an ice box or an igloo, as we call it, and sent to the patient for transplant purposes. So what is this eye bank? An eye bank is the link between the donor and the recipient or the eye surgeon. So the cornea doesn't go from the person who has died straight to a patient. It goes first to an eye bank where it's processed, blood tests are done to check that there's no HIV, AIDS, etc. And then the eyeball is, only the cornea is removed from the eyeball in the eye bank, and then it is sent to the patient. So how quickly should the eyes be removed after that? As soon as possible, but eyes can be removed up to 6 hours after death. However, in places where the climate is always hot, like most parts of India and Singapore and many Asian countries, the shorter the duration, the better it is. Is it necessary to transport the donor to the hospital? Not at all. The eye banks have personnel who will come to the donor's home or place of death and remove the eyeballs. Whether you're living in a small hutment, as in the middle picture, or a mansion, as in the other picture, it doesn't matter. The eye bank people will come to your home. You don't have to transport the patient to the eye bank. So who can donate their eyes after death? Anybody can donate, any age. An infant of 1 year, an old woman of 100 years, somebody wearing high minus numbers, glasses, any operated patient, somebody operated by me for cataract or glaucoma or retina surgery, doesn't matter. As long as the cornea is clear, you can donate the eyeball. Even if you have diabetes or blood pressure or heart problem, or you've had a vehicular accident, any cause of death, stroke, suicides, heart attacks, even a cancer patient can donate their eyes, provided the cancer has not spread to the eye, of course. That brings you to the next question. Who cannot donate eyes after death? And these are some of the contraindications. Patients with septicemia, where there's infection in the whole body, or HIV, AIDS, or rabies, these are those whom we don't have. But our biggest problem is those whose relatives refuse donation. You see the picture of relatives fighting over there. That's only half in fun, because we've had patients who have pledged their eyes. They've told us that whenever I'm no more, please come and collect. And we go to collect, and the relatives say, no, we are not giving you the eyes. So you see, after death, the body belongs, at least in India and most countries, it belongs to the next of kin. So if they refuse, it doesn't matter if you've pledged in advance, you can't get the eyes. Does any religion forbid eye donation? No, it's not forbidden in any holy books, as mercifully, eye donation was not practiced when they were written. Certain religious leaders, such as Buddhist monks in Sri Lanka, parts of Thailand, actively propagate eye donation. Some Muslim countries even have issued fatwas, which is a holy edict, calling for eye donation. So it's a misconception and misinterpretation of holy books by in some places where they say you can't donate the eyes. That's not true. Is the procedure cumbersome, time consuming, too many forms to be filled? No, it's easy. Almost no paperwork is required. How long does it take? In Mumbai, with very bad traffic, the eye bank team will still reach within an hour and the procedure will be completed in just 30 minutes. Is there any disfigurement of the face? No. After enucleation, the eyelids are gently closed and usually no one can tell that the eyeballs have been removed. You see this picture, this is a lady whose eyeballs have been removed and you can't even tell. A few ml of blood is also collected from the vein of the heart because you have to test for HIV. I'm so happy that you're all with me and have heard this talk. Let it not just be something that you've heard, but it's something that you will take home. And the next time you find someone dying in your neighborhood, in your building, in your area, in your rotary, you will at least pop the question to them, would you like to donate eyes? Find out the name of the nearest eye bank and the telephone number, call them up, and the rest, as they say, is easy. Thank you so much for your attention.
A very interesting presentation, Past Assistant Governor Dr. Qureshi. Thank you very much. The next person I thought I would like to introduce is, of course, the person who we talk about, OBIS. OBIS is the first and only flying teaching eye hospital. And where can we find this person? Of course, from our own, very own Rotarian, past Assistant Governor, Dato Kula Sigaram. Dato, would you like to share with us, since you are on the board as of OBIS International?
Thank you very much, CPQ. Thank you, sir. First of all, a very good evening to all of you. I'm delighted to touch base with you all during this panel discussion. Particular word of appreciation and thanks to the organizers, Rotary Club of 331 Singapore, especially to CP Chuban Singh, Clarence Young, and Kwok Wing Ching. They've obviously put in much time and effort to organize the important panel discussion on blindness prevention. Special mention also to my esteemed fellow panel member speakers, PG Cesar, PP Dr. Koresh Maschetti, to whom I'm sharing this platform. Ladies and gentlemen, the fight against blindness is far from over. About 90% of people suffering from blindness are in developing countries, namely all countries in Africa, South and Central America, almost all countries of Asia, and numerous other island states, totaling 6.53 billion, 152. 40 ICA is out of touch to millions worldwide. This is where OBIS comes in. OBIS International is headquartered in New York, with offices in Toronto, London, Dublin, Hong Kong, Macau, Shanghai, New Delhi, Bangladesh, Cape Town, and Singapore. OBIS International is headed by Chairman Kevin McAllister. As the President and CEO, Derek Hotkey ensures the fulfillment of the OBIS mission under the guidance of OBIS International Board of Directors. Ladies and gentlemen, since 1982, our capacity building programs have enhanced the skills of 325,000 eye health personnel and provided medical and optical treatment to 23.3 million people in 92 countries. First video shows the world's first and only flying eye teaching hospital on board an MD-10 aircraft. I would say the largest icon of a charitable organization this world has witnessed. The mission is to to teach and train eye care professionals worldwide and constitutes about 25% of its programs and activities. Let's watch this 3-minute introductory video to better understand Orbis philosophy, the fight against blindness. Please.
محمد
45 million people in the world are blind. 80% of these people's blindness could be prevented or treated. 90% of blind people live in low-income countries. The need is greatest in the developing world, yet quality eye care is out of reach for most communities. International sight-saving charity Orbis operates the world's only flying eye hospital, which since 1982 has been dedicated solely to teaching and training eye doctors, nurses and biomedical engineers in the skills needed to save sight. The Flying Eye Hospital is aviation innovation at its best. An original and constructive use of an aeroplane, it is a force for good, inspiring hope in people and governments to work together in the fight against blindness. Flown by volunteer pilots, our unique aircraft relies on the support of our host nations, their airports, and the aviation industry at large. Their help makes our work possible. Orbis maintains a team of 22 highly trained staff who travel with the Flying Eye Hospital to countries most in need. With specially designed teaching facilities, our medical volunteers donate their time to provide hands-on training, enabling the transfer of expertise, skills, and knowledge to local eye care teams. These are the eye care teams of the future. They go on to treat and educate within their own communities. This teaching, along with Orbis's on-the-ground commitment to strengthening local hospitals, means that eye care is available to people who never thought they would see the light of day.
The Flying Eye Hospital is probably the most unique aspect of the organization. In fact, it's probably one of the most unique things in medicine. It combines the power of aviation as well as modern-day eye care in a single aircraft. That plane is not only able to deliver eye care, it's allowed to train individuals, it's a powerful advocacy tool as well as public awareness. Our surgeries not only give someone the gift of sight, it really gives them the gift of going back to society.
Orbis has worked in more than 85 countries. Our aircraft brings to light the needs of blind people and the issues of global blindness. It influences national leaders and their decision-making, contributes to the development of national eye care policies, and works towards creating long-term, sustainable solutions with the countries it visits. With the backing of our aviation supporters, Orbis has achieved so much, yet many more need our help. Orbis offers a practical solution to the overwhelming problem of preventable blindness. You can be part of that solution too. Join us on our journey.
Right. Eye care teams around the world using the latest advancements in internet and mobile technology via the CyberSight platform enable teaching and training to be carried out, broadcast to the world at large. CyberSight is a digital extension of our mission. In 2019 alone, CyberSight trained 7,600 eye health professionals from 183 countries. We also added 8,000 new users and held 115 live events. The teaching and training is advice from experts. Is easily accessible via mobile phones, tablets, notebooks, or PCs. The activities of Orbis include the Flying Eye Hospital, country programs, CyberSight, telemedicine, volunteer faculty, technology and innovation, community outreach, partnerships and collaboration, blindness, gender inequality, women and girls. In 2019 alone, ladies and gentlemen, all these programs resulted in over 66,000 completed training for doctors, nurses, and other health work. However, the impact reaches far beyond these numbers. Hobby's philosophy to change the way the world sees. Hobbies has helped to change the way people view blind. It is not an ailment that cannot be treated. With innovation, technology, internet simulation training, and experience of eye care professionals, preventable blindness can indeed be reversed.
If you're an eye health professional in a low resource country, it can be difficult to access the training and support you need, which is why we take pride in our work at CyberSight and we never stop innovating. For more than 10 years, we have been delivering expert mentorship, exclusive online courses, and full access to textbooks and manuals to thousands of eye health professionals all over the world. And CyberSight now offers new ways to do even more. We have been adding brand new and completely redesigned courses and live interactive lectures delivered by world-class clinicians and professors. Now you can participate in Orbis Flying Eye Hospital training programs from anywhere in the world, with live broadcasts of surgical cases, narrated by the surgeon who will answer questions in real time. You can access these tools and more from the comfort of your clinic or home, using a computer, tablet, or smartphone. All of our content is optimized for mobile devices and designed to work even on slow connections. Access to the world's leading eye health experts is in the palm of your hand. Discover CyberSight today at cybersight.org.
CyberSight, if I may add, ladies and gentlemen, in fact, has increased several fold because of the COVID pandemic enveloping the world. Indeed, I learned this evening that CyberSight has now increased its volume of usage by people across the world 7 times the 2019 figures. Anyway, I now want to move on. We now present a slide which encapsulates the essence of simulation, highlighting the work that is carried out in simulation training. Simulation is recreating a scenario based on an actual operation. This is done for the purpose of training and evaluation. Simulation training is carried out in a dry or wet lab setting, helps to develop and hone the skills of eye care health professionals. And with that, I wish to say thank you very much for your time and trouble of attending this panel discussion. Thanks a lot to everyone.
Thank you, Dr. Kula. Can I invite all the panelists back so that we have a chance to have a panel discussions? Welcome back, all of you. Dr. Kulai have talked about internet. I thought today's society we talk about 5G and AI, artificial intelligence. And of course, what have happened is that it have also revolutionized not only every industry, including the medical field. Of course, people like University of Monash is talking about the bionic eyes, but this is, I think, something of the future. Can I talk about the possibilities today as it exists? Number one, of applications that are available in the market to help people so that they can do better in their job and they will have greater opportunity rather than just being blind mature, which of course they are very, very good. Application can be both hardware and also software. So can anybody would like to talk about it first?
Yeah, Bansing, and see, it's a very good question you asked because many times patients read things in the lay press where things are highlighted about a new artificial eye, a new bionic eye, or a chip put in the retina or a chip put in the brain, and now blind person can see. And every blind person feels that they are now a fit case, and they come and ask the eye doctors, now doctor, when will you perform this surgery, or can we see now? We must remember that the lay press likes to sensationalize things. There is not a single device which is out there in commercial use for which is an implantable chip or anything like that, artificial retina. They're all many light years away from being commercially used. They're still at university level, costing millions of dollars, and are being implanted in volunteers in small, 8 cases here, 12 cases there, things like that. So we are still a few years away from mass production, and we as Rotarians should discourage this because it's very, very expensive at the moment and not worth the expense for Rotary. We should concentrate on low cost treatment for helping many, many more blind people, like through eye donation or through cataract surgery, or even through simple things like vitamin A being given for nutritional blindness.
Interesting. Shahad, are
Yes,
you
I
able to
agree.
comment about?
Yes, I fully agree with Dr. Quresh that since Rotary is a social service organization, and so we should try to uh, participate in the projects where we get value for the money. And like for example, cataract surgery, it takes only $30-$35. In some countries, even less than that, and a person can have their eyesight restored. So small interventions like this, I think we should go for these rather than going towards very expensive treatments, things like that. Because of course, anyone who can afford can do that at their own. But for us, we should try to leverage our money, our donations, our contributions, so that maximum we can uh, we can pass on this benefit to maximum people or participants. Another thing I think what we can do is that, for example, another what we do, our club does here is that we participate in early disease detection programs, where we just go to the schools and have their eyesight checked, have their hearing checked, and sometimes we find out that there are children who do not actually know that their eyesight, there is some problem with their eyesight which can be cured. So we detect such cases for blind for like through the eye checkups as well as through the hearing checkups, and then we just refer them to the participating hospitals where they can get their treatment done. So this is very, very, very cost effective, and it can also change the lives of the people. Thank you.
Thank you. Dr. Kulai, I believe you are involved in some application about with the phone, so that people who are visually impaired can actually use the ability to use the sound to be able to work through the process. Can you explain a little bit about the application that you are talking about, Dr. Kulai?
Certainly, CBQ. This is actually, I'm on the board of a company called sorry, am I online? I'm saying on the board of a company is manufacturing telephones with an application specially designed for elderly and visually impaired persons. There's a company called Zone V, based in London. And if you like, I can send you literature on the application which we have developed. You see, particularly now with the COVID situation, the elderly people are not able to move about free. Communication is vital, and therefore this device helps to speed up communication by making smartphones that much more simpler to use, right? And this is now being marketed in London as a pilot project, and hopefully it'll come to Asia in the not too distant future. Thank you very much for giving me the opportunity to talk about this device.
Thank you, Dr. Kulai. The other thing I wanted to talk about is perhaps District 3300 and 3310. have a joint Seeing Eye to Eye conference on a yearly basis. We alternate each year where District 3300 will host 1 year and then the following year 3310 will host. I think this conference, Seeing Eye to Eye, is now in its 10th year. I believe that 2 years ago we were talking about going to going regional with the conference, and the process was called ASEAN and Beyond. Given the fact that now today we are in a Zoom world, literally, where we actually can zoom in and zoom out, I think this is something that will be more interesting, where we can actually invite speakers from Pakistan and India to participate. Dr. Kulai, since you are very much involved in this Seeing Eye to Eye conference, can you share with our two panelists so that they can actually give their input? Dr. Kulai.
Thank you very much, CPQ, for this opportunity to talk about the Seeing Eye to Eye project, which we started 10 years ago together with my counterpart in Singapore. At that time, it was P.P. John Tan, who was blind in one eye with glaucoma. And he and I had a chat over coffee in the Mandarin Hotel, Singapore, and decided that seeing eye to eye between Singapore and Malaysia was so very important. This project has been going. Last year, it was our turn in the 3300 to organize the conference. And we did a Zoom conference at which we had about 250 participants from across the globe, including representatives from the WHO, speak as one of the speakers. This year, the ball is back at the feet of 3310, and I'm informed by my counterpart, CP James Gomez, that the Rotary Club of Kota Kinabalu, Sabah, will be the host club, and they've asked us to recommend some speakers. But I want to talk particularly about the aspect which you touched on, CPQ, i.e. going regional with this conference. There's always been our intention, certainly mine, that we make this regional conference. And now with Zoom as the available medium, I think time is ideal. And I want to suggest to my counterpart, CP James Gomez, that we make this a regional conference encompassing India and Pakistan. And we can do that easily because the theme has always been, until now, ASEAN and beyond. And we have 10 countries in ASEAN which will participate. And if we can include India and Pakistan within the ambit of this conference, I think it'll be ideal. And I want to add also that since Shehzad is online as one of the panelists, Shehzad, we can make our Rotary Action Group, International Group, one of the co-sponsors of this conference. And I'll send you the details. If you can't give me a commitment now, please think about it. And then I think it's a wonderful opportunity for us to join hands. They represent not only Pakistan, but also the action group on which you and I sit on the board. And we jointly can move this together. And Dr. Mascati, sure you'll bring India into the fold.
Yes, most certainly.
Thank you, sir. And I'm sure that PDG Shehzad will agree it's a good idea to open the doors to Pakistan as part of the region. So we make this a regional conference rather than a bilateral conference between 3310 and 3300, as has been the case till now. CPQ, I trust this answers your question.
Thank you. Sahad, would you like to add something to that? Because you are the chairman of the Rotary Action Group. And then, of course, I come to Koresh as well.
Yeah. And so the whole world is struggling because of this COVID situation. But there are some opportunities that we have got through this also. And I think interacting online is one of them. even though all these tools, online tools were available, StreamYard or Zoom or many other were available earlier also. But this is time now that people actually have started using them. And so, for example, now the last year, the conference, the CEAS conference, which was held, so I also participated in it. And that was possible only because of the fact that it was on Zoom. So I fully agree that all these informative conferences, they should have a wider audience. And so I support if they want to go global and go regional. So whatever we can do, we can work out the details and find out how we can participate, how we can collaborate. And it will be an excellent opportunity, especially as long as it is on Zoom, it is or any other virtual forum. It will be easier for everyone to participate from whichever part of the world they are living in. And hopefully one day, soon, we'll get rid of this COVID situation also. So I look forward to having to participate physically in such conferences also. Thank you.
Yeah, we look forward to seeing you. Kuresh, would you like to add something?
No, I echo the sentiments of everyone that nothing like a physical conference. It's wonderful to hug each other and meet and greet each other, but Zoom comes close to that, and at least it achieves a lot of the objectives of a physical conference.
Thank you. So with this, we will have the opportunity to get experts from different parts of the world to come and share on their experiences. The last question I want to leave with you, and I like to sort of, as part of the rounding up, is to ask each one of you, what do you think as Rotarians, what more can we do in respect of prevention of blindness? A lot of Rotary Club, like my Rotary Club, Rotary E Club of 3310, Give of Sight is one of our signature projects. And what we do is we have been doing cataract eye operation. We have done in Nepal. We are going to go into Bangladesh. We are in Indonesia, and of course we are in Malaysia. So that's something, as Koresh have said, is cost effective, because for the same amount of money we can do thousands of people rather than with the bionic eyes you can only do for one person. So to leave with you this thought, can I ask each one of you, perhaps we start with PDG Sahat, to share with us what else can Rotarian or Rotary Club do in the area of prevention of blindness beside cataract eye operation?
Okay. Thank you, Past President Chu. One thing, again, taking advantage of these online meetings, I think we need to broaden our horizon and share our expertise that we have been doing in the past also. But now with this online opportunity, I think now we can have a much wider reach, and so we should continue sharing our expertise. We should continue collaborating on the grants, on the different programs that we already are doing it, and we should continue doing it. We should actually think of enhancing it. And as you know, this term blindness prevention shows that there is the word prevention in it. So with very less with very, it is very cost effective. With very less amount, we can change the life of a person. A person who cannot see can start seeing just by very small interventions, especially in the blindness area. So this is the advantage that we have, that we potentially have the opportunity to reach out to maximum people, maximum beneficiaries through the Rotary programs. And we should take advantage of the Rotary Foundation grants, the global grants, and where we get the multiplier effect. And of course, whatever we can do in our own capacity as individuals, as a Rotary Club, we should continue doing it. But again, to enhance our scope, we should take advantage of the Rotary Foundation global grants so that we can do it on a much better scale, much larger scale, which means that we will be able to reach out to more people, and we will be able to change the lives of many of the people that are suffering because of one of the other blindness related ailments. Thank you.
Thank you. Thank you. Dr. Kurish?
Yes, I echo what Shahzad has said. I'll just tell you, see what happens is each club should first decide that they should do something in the area of prevention of blindness. Now, if they are a single club and want to do just a small project, as Shazad said, they can just pick up neighboring schools and match the schools with eye care professionals so that free spectacles can be given to those children who are screened. Every child can be screened. In India, for example, what we do is we teach the teachers. We teach the teachers how to just examine for three things. We give them a vision chart so that they can check the vision of each child. Each child, just one child a day they have to check. Just one child, so it's not a burden. And close one eye and check, then close the other eye and check. So they check the vision. If there is a difference in the two eyes, we tell them to report. Then we ask them to check if there is any obvious redness in the eye, and we ask them to check if there is any obvious squint. The eyes are not looking straight. Very obvious things. So these three things we train the teachers, and we ask them to check only one child. So if an average class has 50 children, in about 2 months' time, they finish checking the class. Then from there, those children whom they have identified as having a problem, they are then sent to the eye care professional. The eye care professional visits the school. And then those children are picked up and screened further for cataract or squint or whatever it is, or spectacles, and given these free. Now, this can be done at even a small club level. If you're combining hands with clubs, you can cover a vast community and just distribute vitamin A to the slum children, because most of these have vitamin A deficiency, and prevent nutritional blindness. Talk about just nutritional food and see whether the children are getting nutrition. So here in India, we have something called a midday meal program, where children going to poor government-aided schools are given a midday meal which is highly nutritious. We found that their eyesight improved with this, as well as the attendance in schools improved, because parents who could not afford a square meal for their child would send the child to school only so that they could get one square meal a day. So this is with a combination or in the district. And of course, as Shazad said, you can go in for global grants. My club has set up an eye hospital in a remote hilly area of India, where the tribals, the villagers are brought from great heights to the hospital for surgeries. So the sky is the limit as to what we can do. But we must determine ourselves that each of us must do something for our less fortunate. Thank you, Ben Singh.
Wow, that's very good. Very good summary of what's possible. Whether what one is doing a very small project, or one can go all the way upskill to actually setting up an eye hospital. Tato Kulai, would you like to add and on whatever they have commented? Tato?
Yes, sure. I want to say that I'm fully in support of what Shazad and Maskati have said. And I want to also hark back to what my own District Action Group on Blindness Prevention is doing as an example of what other clubs can do. You see, in 2017, in 2018, we teamed up with One Side Foundation of the USA and screened and entered into vast screening projects with them. In 2017, we screened some 12,000 persons, 75% of whom were school children. We gave away eyeglasses to them. And in 2018, we did a similar project. This time we screened about 14,000 persons, 75% of whom were school children. We gave away eyeglasses to those who needed. And so these are some things we can do. Apart from cataract surgery, screening is something we can do. Additionally, giving eyeglasses and also industrial safety, and also we can join up with partnerships like the Alliance and other clubs and other organizations which have a similar focus. That's Rotary. I therefore advocate that partnership is vital in Rotary movement, particularly when it comes to, seeing eye to eye along the path of Rotary. I therefore propose that those of our clubs who have not join hands with Lions, for example, we do so and bring them into the fold of eye care so that we do things in a joint way. And, that way we benefit the larger public. Thank you, CP Chu.
Thank you. So we're now, Rotary is actually looking for partners in action. And I think what the Dato Kulai have just summed up very well, that when we want to do something, we don't just do it alone. We got to work with other organizations who are specialists and they can actually bring stuff together and we put all together, package it all together. And I think together we can make the world a much better world. So ladies and gentlemen, I'd like to thank each one of you for being here today. PDG Sasad Ahmad, past Assistant Governor Dr. Quresh Maskati, past Assistant Governor Dato Kulai. Thank you very much, and it's been a wonderful opportunity to share about prevention of blindness and what Rotary has done, what OPS has done, and what we could do much better, whether it's a big club or a small club. Together, we will make this a success. Thank you very much.
Thank you,
Thank you.
CPQ. Thank you, sir.
Thank you.
Thank you to my panelists.
Thank you,
Cesar
everyone and
and
everyone.
Thanks, Bansing.
Thank you all.